Great. Thanks, Virginia. Should we start?
Yeah.
Hello, I'm Judy McEwen. I'm the MS nurse for Canterbury and work out of the MS Society. I'm going to talk a little bit about the role of the MS Society in Christchurch and my role as an MS nurse for Canterbury. Rachel, our physiotherapist, is going to talk about fatigue, and we're happy to answer any questions at the end. I see lots of faces I know here, so some of you will be well aware of what we do at the MS Society. But we provide a lot of support and information for people with MS, certainly for people, their families, friends, lots of education for people as they require it. So just looking at the people that work in our society, we have a manager who oversees all of us, an office manager and an office assistant, 2 registered nurses, our Parkinsons nurse, Bronnie Alexandra, and I, the MS nurse, 2 physiotherapists. We have a yoga instructor and an exercise leader, and a fundraising, not a funding raising, but a fundraising events coordinator. She does a huge job for our society. We have a social activities coordinator and an events assistant. And of course we also have lots of volunteers. And some of you probably are volunteers at the society. So as I said, I'm going to talk a bit about my role as a resource nurse. I'll talk a little bit about assessment of new clients and annual assessments of some of our clients. That's a really good photo of me, I thought. Okay. Yeah, no, I want to go this way. So just a little bit more about the society, really. I'm sure a lot of you here know about some of the services we provide. We have a gymnasium. When I go to see people or our Parkinson's nurse goes to see her clients, we may refer people back to our physiotherapists. They then will assess our clients, and it might be that they want to take part in our gymnasium and go along to groups and classes there. We have a yoga class, an exercise group. What else do we have, Rachel? We've got quite a few.
We've got
a library.
Yeah.
We've got quite an extensive library. We have subsidised podiatry, taxi vouchers, mobility. We can help people with mobility cards. I'm sure there's lots more, but they elude me at the moment. Whoops. So some of the things that I do, I cover from Ashburton to Kaikoura as my role as the MS nurse for clients, for members of our society. Another part of my position is teaching and educating people on some or the 3 drugs, injectable drugs that are given to people that might qualify or might qualify for those drugs. So I would go from perhaps Timaru over to the west coast, and it's about educating people and following them up. Part of what I do, or a big part of what I do, is going out and assessing new clients, newly diagnosed people that make contact with us. I will go out to see them, or they come to see me. Sometimes we meet in a coffee shop, and I look at all aspects of their symptoms of MS, and that would include mobility, their mood, their cognition, nutrition, activities of daily living, sleeping, bladder function, bowel function, and, things like pain, spasticity, vision, any medication issues that people are having. Some people may not have lots of support in their community. They may live alone. It's important to be able to identify some of those issues. From that, I can often offer some sound practical advice, and or refer people on, and it might be I refer people to a physiotherapist, it might be to an occupational therapist if they're requiring a bit more assistance at home. Certainly the continence advisor, and also GPs. We link in quite a lot with GPs and some of our neurologists. I usually go back to my office and develop a plan and look at where I'm referring people to if I need to, and then how often will I review that and how often will I follow people up. Some people perhaps need to be followed up, within a few weeks, or not at all for a few months. Some people just might touch base with me. I might go out and see them, or they come and see me. I go over the assessment with them, and we spend quite a bit of time talking about their diagnosis of MS and what that means for them. So I might not, those people may choose that they don't need to see me for another year, or they will just contact me as they need to. And it might just be for information or to clarify some issues they might be having. As I said before, part of my role also is for clients who meet the criteria to commence on the injectable drugs. There are only 3 that are funded by Pharmac in New Zealand, and there are more, but I think probably some of you know that they're self-funded. I educate our clients on how to self-inject and the side effects related to that. And it's about understanding all the safety aspects about injecting. Okay, that's me. I'm sure there is heaps more, but I don't have time for that today. But we're happy to answer questions after Rachel's finished.
Thanks, Judy. So my name is Rachel Blade, and I'm one of the physiotherapists at the Society, and I share my post with Jessie Snowden. I'm going to talk to you about fatigue today, very briefly, just as it's one of the biggest problems for people with MS. So this is a quote taken from a member who's recently participated in our fatigue programme. And she describes it as, it's just not a healthy tired. It's that draining, sickening tired that engulfs you. It weighs you down. So it's more than what most people would normally feel as just a tiredness from doing too much activity or exercise or having a bad night's sleep. It actually affects somewhere between 75 and 90% of people with MS. And actually for many of them, that's the worst symptom that they experience. And that's for a number of reasons. It's in general one of the hardest symptoms to deal with, and is often the symptom that they find stops them carrying on with what they call their old life. So that may be their roles within work, it may be their roles within their home and their family, it may be about those social activities that they always enjoyed, going out with friends, that sort of thing. And it's very difficult because, like I said, it's not just that tiredness that people experience. It doesn't always get better after a rest or a sleep. And what's really hard for people suffering with fatigue is for others around them to actually understand what they're feeling, because physically, to you or me, they don't look any different, but that tiredness, that fatigue can be really overwhelming. Another thing for a lot of people to struggle to understand is it can be so inconsistent and unpredictable. One day you could do a 90-minute walk, no problems at all. The next day you might manage 5 metres down your corridor and feel just as exhausted. And the other thing that's quite difficult for people to understand is it can be really out of proportion to the activity. So dependent on the person with MS, physical activity might not be a problem, but it may be something like concentration that makes them really fatigued. So being able to read an item or concentrate on the computer for a period of time can be just as exhausting. So there are a number of causes for fatigue, and obviously there in the centre is the suspicion that there's a primary cause, something related to the pathology of MS that causes people to be fatigued. But currently that's still a little bit unknown, and as a result, obviously we can't manage or treat that area. But around it we have what we call our secondary causes of fatigue. So those are things like sleeping badly, poor diet, not being able to exercise as much, side effects of maybe medications that they're taking. Sensitivity to heat is quite a common one, depression, low mood, generally their work commitments or their home commitments, family commitments, that sort of thing. Other health conditions can also have an impact, and other symptoms related to their MS. And quite importantly, whether potentially they're in an infective episode or a relapsing episode of their MS. So what do we do? Well, we try and recognise which of those secondary causes tend to trigger that fatigue and try and address those and minimise them where we can. We then try and maximise and manage what energy people have as best they can, and there is some medications that can be used, although mild success with these. The important thing to remember is, unfortunately, it's really hard work to manage fatigue. So one of the things that we start with members of the Society, if they're experiencing fatigue, is to encourage them to keep a fatigue diary. So we encourage them to keep it for a 7-day period, and for some of them that's quite a task in itself. So we ask them to record in 15-minute blocks what activity they were doing and scoring it and how fatiguing it was and any particular comments. And then based on that diary, we review what activities on a daily basis or even a weekly basis seem to cause the most fatigue, and suggest then that they do one of the 4 Ds. They either dump it, it doesn't need to be done by them. We all tend to do tasks that really aren't essential in life, so we can get rid of them. We suggest that maybe they delay it, so it may be that every Tuesday when they've been at work all day, they would normally come home and do the ironing and do the washing. Well, could the washing and ironing be left to another day when you haven't worked all day? So can they delay those activities? Can they delegate that task to someone else? You know, is that another family member that could do it? Is there a work colleague that could do that task? Could you get the friend to arrange the social event rather than you? That sort of thing. And if they essentially have to do it, can they do it better? Can they do it smarter? You know, can they be more efficient? I'll give you an example of someone that's recently participated in the fatigue program. She used to dry her hair after a shower standing because there wasn't a socket close enough to the mirror to hold her hairdryer by the mirror. And so by the end of it, she was absolutely exhausted, completely worn out, and she would have to sit and rest for a period of time. But by simply putting an extension cord on, she could sit on her bed, dry her hair while sitting on the bed, and as a result could then go on with the next activity without a rest. And the other thing we really try and instill in people is respecting their limits. So accepting that there are going to be days when you're more tired and actually you need to rest. And that's completely acceptable and completely normal. So we've developed a program called the Minimise Fatigue, Maximise Life program. It was developed principally by Jessie Snowdon, who's my colleague at the Society. And she did it in collaboration with a number of MS members who had completed the first course that we offered. It's an evidence-based self-management program which really focuses on group support and problem solving. People attend for a 2-hour session for 6 weeks, working in small groups of about 6 members and facilitated normally by a health professional. It's currently been offered in Christchurch for about 18 months in a sort of developing program, and this year we are going to be taking it out to a national level by offering training to other facilitators from across New Zealand, with the hope that by 2015 this program will be offered throughout the country. I'll just quickly touch base a bit more on some of the other physio services. I know Judy's quickly mentioned them. So we offer one-on-one clinical assessments with any of our members, and then appropriate treatment and intervention as needed. We support them with exercise because we know that exercise is important in the long-term management of the condition. So that may be exercise groups at the Society, it may be exercise programs in someone's home, or it may even be exercise programs in the community, whether that be a gym or an exercise group. We have good networks with other health services, and so we will refer appropriately onto those, particularly services within the CDHB. And we spend a lot of time providing advice and education, whether that be to members, their families, other health professionals, or other organisations. So that's just a quick highlight. Any questions? Oh, that's okay. Was there any questions?
Maybe you would like to speak to the infants who were sort of speak to them outside because they have their desk outside.
Yeah. So Judy and I will be at the MS and Parkinson's desk if you've got questions.
I think so.
Excellent. Thank you.
Yeah.
Thank you.